there's a great return on investment for that. We've done a lot of work over 20,000 patients over the last 5 years, with upwards down, and had it validated broadly. For every pound you spend in those intervention services, the return is £4 in your P&L. Somebody's got to take that first step. And it has to be leadership. It has to be the CFO or the CEO or the executives have to go. We are going to do this. We are going to spend this money. And we know that it will return, but we've got to have the faith that it will.
Hi, I'm Belden Mankiss, founder of Mankiss & Associates, the strategy firm for businesses with a broader purpose. Welcome to The Purposeful Strategist, a podcast about how business leaders are bringing their organization's purpose and strategy to life. My guest today is James Murray, Chief Executive of HCML, a leading provider of health, well-being, case management, rehabilitation and treatment services, corporate legal insurance and private medical insurance markets. Founded in 2003 and acquired by healthcare specialist investor Apposite Capital 2021. And it's tripled its revenue through organic growth and acquisition and expanded from specialist case management and rehabilitation to corporate health and well-being. James trained as a pharmacist and spent his career in healthcare leadership. Before joining HCML in September 2024, he spent 4 years on the executive board of Nuffield Health. James, welcome to The Purposeful Strategist.
Thank you. Thanks for inviting me. Nice to be with you.
No, it's really great to have you here. So just to kind of get us into it, can you give us a sense of, I ran through a whole lot of words there about the various different things you do and who you do them for, but what does it actually do and what's its place in the healthcare sector? What's the role it has?
Sure. So thank you. And a wonderful summary of what HCML's done in its history. But if I distill it down to what is it we do, we help people get the right care that they need as quickly as they can and try and get the best outcomes for them. Which sounds kind of straightforward, but healthcare, particularly all over the world, really is pretty impenetrable. And if you've got some complexities, as most people have more than one challenge, trying to navigate through pathways and systems and doctors and nurses and consultants and hospitals, it's incredibly difficult actually. And even if you're in the healthcare sector, as I have been all my life, and I'm one of those people that come from a family of healthcare people as well. Even when we get challenged, it is difficult. So what we do, our secret sauce is we help people navigate that and we reduce the impenetrability of healthcare. So we either do that for corporates in terms of occupational health, but really the health and well-being side of it. So when people are poorly or got long-term illnesses, we do it in the therapy services, so physiotherapy and mental health services, and we do it for those patients that unfortunately have been personally injured through either motor vehicle accidents or at work or whatever it might be. We support them through it. And so what we do is help people get access to the care that they need. And what's in our DNA that covers all the services we provide is a really tailored case management. So that's what we do. So that's thinking about the patient, the employee, and all of the challenges they have and helping them get access to the right care. So ultimately, live a healthy and happier life.
So let me make sure I've kind of got that, because at least in my mind, often when I think about healthcare, I think about somebody who's got some serious illness, they're in hospital, they've got monitors and things beeping and all that sort of stuff. Or there's some procedure that needs to be done there, But it sounds like what you're focused on, not necessarily exclusively, but more is the bit that almost, at least, let's put it this way, it doesn't show up in TV dramas a lot.
Yeah, for sure.
It's the bit that, that something's not right, and it's probably going to take a while to get right. It's not a take a pill, have an operation kind of thing. And if I've got it right, part of what you're doing is helping, of all the various different things that might be good there, helping people, as you've used the word, navigate, get connected to the services, the care that's going to help them get better at that point.
Exactly that. It's the boring but really important part of it. So if you have an acute episode, so as you've described, I fall ill and I go to the hospital, or I have an intervention, I have an operation, that's the bit that the system actually does relatively well, where it's emergent care. When it's follow-up or it's chronic care, then actually the system doesn't help you. You have to know how to navigate it. And within that, structurally, that disadvantages those from lower income lower income backgrounds because, they're not exposed to it in the same way, or maybe don't have the same benefits. So let me just give you an example. So when we provide occupational health services, if you've got an employee in your business that's got a lot going on, they've got a long-term condition, which has what I'm going to sort of call it biological, a psychological and environmental components to it, because they often are, then we'll work with them to find out the right path for them. And we know this for a long time. Actually, people say, oh, I've got a backache. You probably haven't. You've probably got a back condition. It's giving you pain. You're not sleeping properly. It's affecting your mental health, and then therefore affecting your ability to work. So we'll manage that patient to get access to the right care that they need, thinking about all of the stuff that needs to be solved for that person to either get back into the workforce, to start living as independent a life as they can. And that's the case management that I'm talking about. And that is really listening to the patient, getting them quick access to the right services they need and the best outcomes, both their experience, but also their clinical outcomes as well.
James, I think I also hear in that something I'm sure you've heard a lot, maybe even said a lot. People talk about the NHS just sort of as a touchstone, and it's the National Health Service, but often it's the National Illness Service, when you're really unwell. But it sounds to me like what you're doing is really getting the focus on, we're not just trying to get you out of being critically ill, we're trying to get you back to a full, healthy life. Am I being overly rosy about that?
No. So let me give you another example. So we work with insurers and lawyers, and actually, I'll come to it, you can be quite cynical about them. However, if a patient has been injured, so they've been in a motor vehicle accident and they've got some life-altering illness, catastrophic injury, brain injury, amputations. And we've got about, any one point in time, 2,000 patients that we're helping with that. When you get discharged from hospital, that's the NHS that's done its bit. And that follow-up care is often not great. They don't get called. So, and say you've had an amputation, you've got to go back to your own home, figure out the changes you need in your house, think about, can you go back to work in the same way? How do you, get support from the government if that's there, because your circumstances have fundamentally changed. Nobody's really doing that, and the service is not set up to do that. So where we get commissioned by other insurers or solicitors, we will do that, make sure that person does that, because they know, and you can be cynical about it, but they know that actually when you get quick, good access to care, your outcomes are better and the costs are lower. So they often work together. They joint instruct in those sort of examples where we do that. And it is the same principle really for the occupational health services we give. The employer wants you working because you're working, they're paying your wage, and there's an output that they expect, whatever that might be. And actually, as an individual, we know work is good for people. It keeps them, healthy. It keeps them happier. It's good for their mental health and all of these things. So actually, the sooner we can get you back into work, whether it's not the same or not, or slightly different, that's good for you, and it's good for the employer as well. So that's what we try and help, and we help people navigate through that, because as I say, it's often not easy. There's a lot of stuff going on, and we kind of solve for that, if you like.
So from what you've said, and just to kind of make sure I've got it clear, it sounds like your customer, and by that I mean the people who pay you money. We'll come to who's the beneficiary in a minute, but the people who pay you money tend to be corporations who have employees that they want to get back to work, and if they can't get back to work, perhaps then they need to figure out what happens there. Or insurers who have some insured person who's, for whatever reason, got an issue, and you want to help them get that resolved.
Spot on.
I mean, if I wanted HCML for me personally, is it the sort of thing I can go to your website and go, I'd like that, please?
No, not yet. And it's
okay.
not. So we're all of our services are fully business to business. So and we don't offer B2C, direct to consumer services for lots of reasons. We've just not evolved that way. That from a strategic perspective, you're going down a whole different route, and we're not there yet. I think, my experience at Nuffield, if you started to develop these things, in the future we may, but for the time being, there's so much demand from either corporates or insurers to provide these services, because they're good returns on investment. That's ultimately, whether you like that or not, if actually it's a good investment for them, they will do it. And then therefore we can be a little bit virtuous about that. It's okay, because we're providing great services and they're going to put the patient the beneficiary. is going to be healthier and happier. So it's good. Everybody wins.
How do you, I mean, a challenge, I think, for lots of organizations that have, as you do, a business model where you have a customer who benefits. Of course, they benefit because they wouldn't be paying if they didn't. But then there's also another population. Sometimes it's just the general public, everybody, the planet. Sometimes it's a specific group who also benefit. How do you strategically navigate through that? I mean, one view is, well, if it's good for the insurance company, good for the corporate, it'll be good for the benefit, it'll be good for everybody. But is that always true? And if not, how do you navigate through that?
There are nuances. It's a really, really great question. So there are nuances to it because, of course, if you're talking about therapy services, the therapist may say, well, the patient may benefit from 6 sessions. And a patient may go, okay, well, I have 6 sessions of physiotherapy. But the insurers may say, well, hang on a second, the outcome we agreed is now achieved. So do they need... So there are different tensions in the system, but our clinical specialists that manage the case are really good at trying to, make sure that we're doing the right thing by the people that commission services, but also that we're not over treating, that we are getting the right outcomes. We're holding the clinicians to account, but also making sure that the patient knows and understands that's it. You've had it, that's fine. You've had the treatment. You can go and go off on your merry way now. You don't need further stuff. So there are different tensions within that we and which is why 2/3 of our workforce are clinicians. They're either nurses, physiotherapists, or occupational therapists. And so we have a lot of clinicians in our workforce that will be used to managing that sort of multidisciplinary care, and also, holding the clinicians to account, making sure the patient's getting what they need, but also understanding that the payer needs to have the right outcome as well, because otherwise, these things become really crazily expensive and then nobody buys insurance. So there's a whole lot of movement in that system, but it's a super question.
One of the things I think I hear in that, James, and it hadn't quite struck me, and maybe I'm wrong. It does seem to me that in healthcare, there's often a sort of information and power imbalance between the healthcare professional and the patient. And not necessarily even really knowing, they're telling me I need to do this, but do I really need to do? And it sounds like to some extent, I won't say it's perfect, but to some extent, because you're looking across lots of things, because you have medically trained people on your staff, you can kind of be in that discussion with them.
One of the things we've got to, because all of healthcare continue to improve, it's the objectivity of the data and how we help people make informed choices about what they want. But it's not perfect, and it's very difficult, because if you have an issue with your knee, if you go to see a surgeon, they'll say to you, I think I can probably help you with that. And if you see a physiotherapist, they'll say, I think I can probably help you with that. And both are not right, or both are not wrong, but they can help you though. So then you've got to assess this information and say, make a choice. And it's not quite as sort of black or white as I'm describing, that often in those circumstances, they'll say, yeah, well, okay, these are your options. This is what you can do. But you'll still have a predilection of those clinical specialists to say, well, okay, I'm going to see it through my lens. And so for us, when we're working with the clinician, it's really important that we can make that assessment, and help the patient understand their choices.
What's the strategy? Where are you trying to get HCML to over the next few years?
Yeah, so we're private equity backed, as you mentioned, by Apposite Capital. They're a specialist healthcare investor, so that's really good for them because they understand healthcare. And private equity's got probably people have an opinion on it, but actually they're just good investors that are supportive of what we are trying to do. Because it's private equity, though, they're growth focused and we're growth focused, so we want to grow our impact. So we want to do more of what we do in those 3 key service lines. So our therapy services, our personal injury and clinical negligence services, and also our occupational health services, but not what I would call old-fashioned occupational health, the stuff where we're helping people with more intractable illnesses to get them back into work and do that. So that our strategy is around growth, both organically, win more customers, but also we'll make some acquisitions in those particular markets as well to help us grow. And that's what, the private equity teams are really good at doing, spotting gems and helping us to bring it all together.
With a PE firm, there's sort of a question of who's really coming up with the strategy. How much of it is the PE team saying this is what your strategy ought to be? How much it is the exec team in essence saying to them, this is what we'd like to do. Do we have your financial backing for it? What's that dynamic like at HCML?
For us, they back the executive team. It's our strategy, and they will support it. I'm sure if we were making errors or it wasn't quite aligned to where they want to go, they might intervene. But from day one, the partners we're experts in private equity. You can run the business. We can't. That's not what we do. That's what you're here to do. So from that perspective, wonderful, because you've got backers and investors that are backing your plan, giving you access to capital to be able to then do what you want to do, whether it's acquisitions or propositions and all that sort of stuff. So yeah, it's great.
And sort of looking at the landscape out there, what do you see as the big challenges and opportunity in healthcare?
Ooh, that's a big question. Yeah, I mean, healthcare historically has always been around, people. So that's patient clinician. It's always been about pathways and outcomes. And then we've got this thing now that everybody's talking about it. And I don't want to sort of sit on that zeitgeist that AI is going to transform everything, but it will make a difference. It will make this pathway easier. It'll help accelerate that conversation we talked about earlier. It's about data, outcomes, choices, and also simply it will help the person to do their job better. We use it in a number of ways when we're doing a needs assessment for a patient that's been catastrophically injured. Oftentimes they will take 5, 6, 7 hours. So we'll use a tool that can record all that skilling and then create like summaries and plans, and it's brilliant. And the clinicians love it. We validated its accuracy, and it's brilliant. And so that cuts down the time, the follow-up time for that by about 5 or 6 hours of admin time. And no clinician, whatever they tell you, they hate admin. They hate doing the paperwork. How we embrace that and control it is a really important part of how we do it. And outside of my sphere, HCML, but if you think about all of the scanning we do for NHS across for all of the different purposes, MRI scans, CT scans, that should be just transformed by the AI-driven diagnostics. So there's the stuff that we've got to do there. But for us at a micro level, I just want more people to access our services because I know we make a difference. So, this is kind of micro and macro, I suppose.
And if we can, let's talk about the NHS and what's going on there and how that fits in with HCML. Because it sounds like a lot of what you do is, as we've sort of discussed, the bit that's outside the NHS. But there's just such a big part of healthcare in this country. It's hard to how changes there wouldn't impact what you're doing.
Completely right. So we don't provide services. Well, we've got a really small pain management contract in Worcestershire, but actually in general we don't work with the NHS for lots of reasons. It's just incredibly tough, and particularly when you're from the independent sector. So the NHS SIMPED, its capability, how it's performing directly affects what we do, because if you think about corporates, if you can't get to see GP, you can't have the knee replaced because you need it replaced for a year, that impacts the business because that person is off or ill. So there's a massive shadow that it casts over for us. And we know that whatever we think about the NHS or thought about it, whatever we think it is or it isn't, it's always going to, from now to the foreseeable, it's always going to be a basic service. And then therefore our perceptions of how quickly we get through waiting lists, how quickly we respond to it, are not going to be what they were 10, 20 years ago, certainly when I started in healthcare in the mid-90s. It's different. So therefore, the pressures in the system are different, and the consequences of that are greater. So if you're an employer, you've got to think really carefully and strategically about how you put your people well, because if you can't, you've got a problem in the profit and loss account because people are absent. You can't get them back into work because the NHS maybe doesn't provide the services they need if they need. So, and this is what Charlie Mayfield was talking about in the Mayfield review. So how do you incentivize or create a system where corporates, employers are doing more to support health and well-being of its employees so that actually we can take more responsibility for that? Because it is self-serving. If you can get people back into work, then it's cheaper. There's a great return on investment for that. We've done a lot of work over 20,000 patients over the last 5 years with upwards down and had it validated broadly. For every pound you spend in those intervention services, the return is £4 in your P&L. Somebody's got to take that first step. And it has to be leadership. It has to be the CFO or the CEO or the executive have to go, we are going to do this. We are going to spend this money. And we know that it will return, but we've got to have the faith that it will. And there is so much pressure in the system to run a business in the UK. It's really difficult to have those conversations with bright, intelligent people who go, James, I know. But at the moment, we are focused on the next 6 to 12 months because we've got to get through because of, just general business pressure. So But so, I think the NHS will always have to shadow over what we do and then have an impact on how we deal with healthcare more broadly. But maybe we start to have those kind of incentives in the system to do it. It wouldn't take much to make those policy changes, where we use things like salary sacrifice, where we think, and actually, I am as an individual more likely to spend my money on my health.
Mm-hmm.
The independent healthcare providers now went for a survey every year, and they show that people's predisposition to things pay for themselves. And, if you're 20 or 30 and in the workforce, you've probably never known the NHS good, always known it in crisis. And I will pay for a GP or private GP appointment. So that it is different to me in that way. I'm not saying it's right or wrong. I'm just saying, just sort of representing what's sort of going on. That's where I see the direction. The NHS is a basic service, and then everybody else has to be incentivized to sort of lean in where it can to help it, whether it's employees or whatever it might be.
I'm going to ask you, if you don't mind, just to sort of speculate a little bit with me, something that I think is in what you were talking about. And I think it's actually a big issue, because what I heard about the need for employers to take more responsibility for the health of their employees. And, even the way I've said that sentence, people could pick it apart and argue whose responsibility, and, but park that for a minute. It does seem to me that maybe I'm imagining a time 20, 30 years ago, where employers did feel responsibility for their employees in a much more rounded and ongoing way than many of them do now. And I just wonder if some of the issue there isn't businesses seeing themselves as, I'll use the word institutions. We're going to be here. We're here. We're going to be here. People are going to come work for us. Maybe they won't spend their whole career here, but while they're here, they're part of a community that cares about more than just the profit. It cares about each other and cares about the health of the organization and the health of our people and the health of the community. And do you see any signs of that, or am I imagining a world that never existed and never will exist?
I don't think it's as cynical as that. We think for lots of really good businesses around, intelligently making decisions for what they want to do about their workforce. So my comment around, actually, it's not easy to do business, in the current climate is not a political one, but we are having really good conversations, because ultimately people know that new people coming into the workforce have a different set of challenges, got a dispersed workforce, and expectations are different. What am I entitled to? How do I make a judgment about you as an employer? So, and we're looking at, going down the B Corp route, for example, which is, because I think healthcare and social responsibility are just the same thing. You've got to do it, should do it. It takes us a while, but you should do it. Because I think people look at you as an employer and say, what are you about? How do you help me? For that reason, for the 20, 30 of those, they've never seen a good NHS or a good healthcare service. And that makes me sad, because my family worked in the healthcare services for a long, many years, and nurses, midwives, and other pharmacists. Anyway, I think businesses are really thinking about what they have to provide for their employees and how they can you become an employer of choice and what you need to do. So it's how businesses are ordered. I think that's the conversation we have. How do we do this, James? How can we get from here to there? How do we provide those services? But people know the challenge is very different, particularly over the last 5 years.
Focusing in on you for a minute, you sort of talked about your family background in the field of health. Trained as a pharmacist, pretty much spent your whole career in healthcare. So what's kept you in the sector, and what drew you to HCML specifically?
I love that. Recruiters speak to me quite a lot, and I will never leave healthcare for lots of reasons. You come into it to make a difference, and how you make that difference, from my perspective, has changed quite a lot since the kind of mid-90s, doing as a pharmacist. But what's incredible about it, and even running a business, and it's a privilege to run a healthcare business, is that you can run a business well, and you can see all the financial numbers, and that's lovely. But actually, at the end of that, you've got patients, and they're making a difference to their lives, and it's very, it's good for the souls. And actually, we see stories and calling individuals that we help, and you see what they're doing, that couldn't do and now can do. And it's so heartwarming. It's amazing that we've got the ability to be able to do that. So, and I believe you can have those things for mutual aid district and run a really good operation, business service, but also make sure that the quality of the outcome is wonderful as well.
I'm just wondering, is there anything, I mean, it's clearly you've talked about it, the sort of the purpose of the business and the impact that you make in people's lives and in businesses. Anything you do specifically to help your employees have visibility to the impact the business has? Because sometimes, it can be, Easy to sort of lose track of what are we really here for. And I've just got this pile of paperwork I've got to get through, and I got 9 more things I have to do before I can call it a day. Is there anything you do to help people make that human connection?
For us, this isn't a lazy comment. It's really easy. And often, so for all of our clinicians that work for us, where they come from, if they're working in the NHS, if you're a nurse, we see a patient at a point in time and then they move on. They go somewhere else, they have to get discharged or, move from acute to rehab to whatever. But our case managers see from start to finish that patient and see where they start and where they end up. So have that, they can luxuriate in the fact that they can see that patient improve and some the direct impact they have on them, which is why, our case managers tend to love the job that they're doing. It is different because it often requires working from home rather than in a bricks and mortar building with the team, but actually that ability to sort of satiate what people came into healthcare for, which is to see something improving. It is there. It's really tangible, and people can touch it, feel it. And we've got loads of KPIs and measures about net promoter score and functional assessment scales, and we can see it sort of quantitatively as well. But actually, that person I'm talking to you, I see you, and I know what's happened. Is writ large for our business, and it's wonderful. It's your privilege.
Actually, a question I probably should have asked you much earlier. But in terms of employees, how big is HCML, and where are people based? What kind of jobs do they have? You've talked about case managers. Is that like the biggest part of the workforce you've got, or is that a specialist bit and there's all sorts of stuff around it?
Yeah, so we've got 440 odd employees. Yeah, it moves up and down a little bit each month. 3/4 of those are patient-facing or employee-facing roles, and of course, not a majority of them are clinically trained, either on clinical registers. So I've mentioned physiotherapy, occupational health, nurses or general nurses. So we've got a whole sort of.
And just in what you said there, maybe this is overly simplistic, but it does sound like like you say, sort of catastrophic things that have a long-term play out, maybe lifelong, and the sort of the more naggy, my back, my knee, whatever it is. What's the mix there? And do you see one of those growing more than the other?
I hopefully see them all growing. Otherwise, we're not doing my job very well. But so we've got about 2,000 patients that are in that sort of catastrophic part of it, and some of those patients will be with us for many years because they've got lifelong. They're never going to be back to where they were before the accident, but we can help them live as independent in life as possible. And then we have 4,000 referrals a month for physiotherapy. So that's a sort of the churn part of that as well. So it varies a lot. We help about 200,000 unique patients a year that go through our services. So yeah, a bit bigger than you perhaps would think, and they kind of split between those different service lines I've mentioned. So
can I ask, who's the competition?
Well, it depends which market we're talking about, which service line we're talking about. So, if we're talking about personal injury case management, we've got businesses like that called Care Group, really good providers, the Handle Group. And then on the occupational health side, some of the sort of real big players in that, like businesses like Health Partners and Optima. And then on the physiotherapy services, that's kind of more federated, if I'm honest. So because of just the way that those businesses tend to be set up as lifestyle businesses. But those are sort of the key competitors. And I think we all probably do something slightly different in that regard. So it's good to have good competition. And when the markets are moving and growing, actually you need that because everybody raises the bar, and that's important for the patients, and it's important to keep the propositions moving forward as well.
Yes, one of the things that strikes me is you went through those names. I didn't recognize one of them. And it's not a consumer-facing business, is it?
No, for sure. That's it. So that we're fully B2B. So some of those, businesses people may be familiar with them, but if you've not needed to use them, you won't be because there's no you're not trying to drive direct to consumer activity. There are plenty of business to business organizations. So, some of those are, £100 million businesses that you kind of, they're big. But that's kind of the way it is. And you're exactly right. You might not have heard of them, but they're there.
Yeah. For me, it's been an education. One of the things I love about doing this podcast is learning about all sorts of different businesses and parts of the economy, and sometimes things that aren't businesses that people are up to. Anything else you'd like to share with our audience?
No, I don't think so. I think we've gone through a lot. I suppose I would just make a plea for anybody that's listening. And where I started with this, healthcare is pretty impenetrable. It is difficult at times, but if there's something wrong, please keep pushing, keep asking the question. You keep seeing in the the news of people that are waiting too long to go and get help and support. But you've got to do that. So the old pharmacist in me is going to tell you that get healthcare and be pushy if you want to.
I think that's great advice, James. I will I'll take that on board myself. Again, thank you for joining. It's been really great. Thanks so much. I hope you enjoyed this episode of The Purposeful Strategist. Just a quick word about the work we do at Menkes & Associates. Our clients face a distinctive challenge. They must deliver financially while making the world a better place. These two can seem to be in conflict. I work with boards and exec teams to help them resolve these tensions. The result? Clarity of purpose and alignment on strategy, which leads to better performance overall. Thanks again, and join us soon for the next episode of The Purposeful Strategist.